Hello there. Today I want to talk to you about good oral hygiene and how to prevent diseases such as tooth decay, also known as caries. What causes tooth decay, also known as caries? Caries is a multifactorial disease. It depends on the host, bacteria, diet, and time. Host. What depends on the host? There are hereditary factors, the age, saliva. More saliva helps to keep your mouth cleaner than with less saliva. Burrows, food gets stuck in there and gets spoiled if you don't clean it properly, and it's more difficult to reach these spots for cleaning. Bacteria, the most known bacteria for causing caries is the Streptococcus mutans. It's normally passive. Everybody has it in their mouth, but mostly passive, and it activates and begins to attack your teeth only under circumstances like when is a low pH, also it's acid, because of the food you have eaten. According to the World Health Organization, 2.3 billion people suffer from cavities in permanent teeth, and more than 530 million children suffer from cavities in milk teeth. Why is it important to prevent or treat caries on time? If it is not treated, the caries reaches deeper spaces in our teeth, causing infections that cause a lot of pain and other diseases such as pulpitis. How is pulpitis treated? The dentist has to make a root canal or crown treatment if it's reversible and give you antibiotics, but if it's irreversible, the dentist has to make an extraction of this dental organ, or in other words, remove the affected tooth. There are other diseases caused by pure hygiene, like the gingivitis, which, when it's left untreated, can turn into a periodontitis. The gingivitis is an irritation and redness of the gums. The gums is the flesh surrounding the tooth, caused by poor care habits, tobacco consumption. Xerostomia, it's when you have less saliva in your mouth, or a poor diet. Periodontitis is a more severe gum infection that damages the soft tissue and can destroy also the bone which is supporting your teeth, causing that your teeth get loose or you get total loss of them. It is caused because of poor oral health, tobacco or drug use, diseases such as AIDS or diabetes. Here you can see, of course, of the periodontitis, that your gums are retracted, that the root is visible, that you are losing some bone, and that your bone is visible. So, like mentioned before, if it's not treated well, you can lose your teeth because they got loose and they fell out after a certain time. How can you avoid these mentioned diseases? All these diseases can be avoided with good habits. Avoiding consuming foods with a lot of sugar or acidic foods, going to the dentist at least every 6 months for checkup, not allowing time to pass if there are first signs of a disease, and consulting your doctor for treatment or prevention, like application of fluoride. In this case, here I have Durafat. I recommend it. It's Barnes. I like Barnes more because it has more fluoride, but the dentist knows which is best in your case, if gel or Barnes. He also can seal the cracks in your teeth. It looks like a injection, but it's only for application. There are the cracks in your teeth, and the doctor is going to seal them so the food don't get stuck in there and spoils, or it's or to help you to clean your teeth, because it's very difficult to reach the deep spots in the cracks for cleaning. And the most important thing, a good oral hygiene. You always should clean your teeth after every time you eat. Not only because the food getting stuck in there, it's also because when you eat, The pH goes down, means it's more acid in your mouth, and so the streptococcus with its habits there is going to be activated and attacks your teeth, and so so a caries starts. When you brush your teeth, try to buy or use toothbrushes which have some curves or little hairs for better brushing to reach the deeper spots. There are some brushes that are plain or flat, like made of bamboos. Yeah, it's good for the environment, but for brushing your teeth, I don't recommend it. Also, always try to use your floss to get into the deep spots next to your teeth, between your teeth, the interproximal places where your toothbrush can't reach very well. So use your floss to polish these spots where it can't reach. Here are some pictures of which food is good and which is bad for preventing caries. Always try to avoid things like sugar or carbohydrates, and try more to eat alkaline things like fresh fruit, shell fruit, and some types of water are fluorized. The fluor helps you always to remineralize the teeth and to avoid the caries attacking your teeth. Thank you very much for your attention. Here are my sources. If you have any suggestions, comments, or questions, feel free to write them down in the comment section below or write me in private. My inbox is always free. If you have any questions, feel free to ask. Thank you very much.